All right, so if you know any of the content that I have made, my name is Evan Strong, and I make videos like this geared around the lacing of our shoes and the tying of our shoes and the things traveling up the rest of the clothing that we wear, especially modern 2024 designs that alter our body's natural functions. I normally stand up and do some kind of visual to show that my body is very, very natural and functions well, and it wasn't beforehand, and all I've done in between, besides releasing scar tissue and stuck muscles from years of patterning through these things, all I've done is the modifications within the clothing that I have shared freely within my videos like this. So prerequisites that I always state are to lace your shoes with my technique, which is this, just like this, okay, where they're going over, laces are going over to the outside and then tucking into the eyelets, and it starts underneath down here. So the other shoe is just the opposite, right? Going over to the outside, tucking into the eyelets, and it starts underneath at the bottom, okay? Same thing all the way up, just exact opposite on each side to allow room for a natural arch. Just because the nature of weaving a rope within the shoe, which is all you're doing, will then allow that inside to come up, as you can see, to just allow the natural foot shape to sit within the shoe evenly on both sides. So that, I don't always have shoes here to show as a visual, but within my videos I mention my prerequisites. That's first thing at the very foundation of the body. And then I always say that includes tying them evenly over toward the inside, right? Like that, evenly over toward the inside, right? And I've shown when you pull that, it twists them evenly. And yes, it's pulling the shoes out, but the nature of pressing against that knot, it will actually put your foot into internal rotation, okay? From here, you just tie your bows over top of that foundational knot. But that's the knot. When I talk about tying them evenly over toward the inside, it's this first foundational knot, because you can see you're just literally tying a knot around your ankle, right? And whatever knot you're tying, the effect of that knot is traveling up the entirety of that body, or that side of the body. So prerequisites, and then I always say also remove the tags from the tongue of the shoe up through every item of clothing that you wear. I've gone into very great depth on what tags do and how they really affect our bodies, and our muscles can't quite activate when they're against something like that that is man-made synthetic material, and it really affects the way your body wants to just naturally work and just doesn't allow it to. So those are my prerequisites that I always state at the beginning of my videos, just to even allow the body to have a chance to function naturally the way that it would before being altered by clothing. So I've talked about this all the time. I've shown this in multiple videos, right? I always refer to this when I'm talking about anything, my shoelacing and tying technique, and that is what it is. This is what I'm talking about when I talk about that. So, because the biggest point is most people, when they tie their shoes, they'll be going the same direction and just do the same knot. And in doing that, the direction they're tying it toward, that side is going to be pulled into external rotation, but rather pushed into external rotation. Because if I tie the shoes correct, right, over toward the inside there, and over toward the inside there, just so it's even on both sides, then as I showed, when you pull this knot, it will pull the shoe out, right? But as I was explaining, pressing against that then allows an arch in your foot, stemming here, the lacing allowing like the lower part of your foot to have its natural arch, just because the way that the rope within the shoe sits. But then as you get to your ankle where you're actually tying the knot, since your foot once an arch like this, when it steps off, you're naturally going to be on the outsides of your feet in a healthy arch, right? And so you're gonna kind of look like this when you walk, outsides of the feet. So pressing against this knot, as you can see, this outside coming over toward the inside in the knot, when you press against it, it reacts like this on the right foot, and it reacts like this on the left foot, okay? So all that is playing into each other just to allow the natural shape of the foot within the shoe. And I always say, or explain, at least when I'm going into depth on the actual shoelacing technique of mine, starting this underneath just places pressure where your toes will flex. And so, yes, I mean, you'll get so much less sore. I really won't get sore. I'm speaking from experience. I go on a 12-mile walk very often on this trail. I come home, I don't have to sit down, I don't have to stretch, I don't stretch. I make bold claims like we should never have to stretch unless something very major happens. And I make the claim that we shouldn't be exercising just to exercise. The body is about a positioning, and this is what allows that to happen from the foundation. So, there's no opinion in that, there's no disputing it. Once you try it, once you see it, and any human on any part of the face of the globe can try this. That's what I talk about within the things that I mention. It's none of this is my opinion. I mean, maybe here or there I might be like speaking on something in a certain way, but like as far as the modifications that I do and the ways that I show that things react, it's not opinion at all. Universal human design, I always talk about, we are all universally designed in the image of our living God, who is Jesus Christ. So the skeletal system of our bodies, right, the actual bone structure and the way that it operates within human beings is universally designed. From man to woman, every human, any age, within your slight differences, if you have any kind of deformity or you've had any kind of like major injury or surgery that could have altered that, then that's your own personal situation. But other than that, we're all universally designed. So this just is what it is, because we all have the same amount of bones, same type of bones, ligaments, tendons, and muscles within the foot. They operate the same way. The foot just does what it does. We all create an arch in the same way. Again, unless you do have some kind of like actual deformity, which that's your situation. So yes, I mean, there's no opinions in this, none. Any and every human on any part of the earth could try this, and this is just the way to cause the shoe that you wear to fit like a glove would on the hand, but for the foot, to allow all the functionality to be there while still having protection against, you know, the earth, things we walk on. So yes, I want to make it very, very, very clear, and I do that continuously throughout the content that I make, but this is not an opinion or a preference. This is the only way, the way that I have found, as far as this is my technique. Not that it has to be mine, but to allow, again, just the natural functionality of your foot within your shoe. That's all it is, and that's what it does. Again, universal human design. So, the reason I say that so like, kind of like beat the point there for a second is people probably have the tendency to think that I just have this idea of what would be good for somebody without knowing them, and how could I say? Right? It's like, Evan Strong, you're telling me to lace and tie my shoes in a way that you think is good for me? Well, how would you know, kind of thing? Well, again, it's not about him versus her or me versus anyone else. It's universal shape of the human foot, mechanical, structural, skeletal system, the way that it operates. This just allows it to happen. So I can speak for every human on the face of the globe in that sense, again, unless you really do have an abnormal foot, which is fine, but that needs to be said, right? So, yes. The point is, this is what will change your life. The extent on what happens to people, just to the human body, again, universal human design, structural, skeletal system, what happens to the human body on the right side of the body, just because generally right-handed people will be tying their shoes toward the right side. So this is the right shoe, right? You see when I pull this knot, it pulls the shoe out, and I've shown this before, but if I were to tie this incorrect, what I show right here is incorrect. But if I were to tie this over toward the outside and pull it, it just pulls the shoe in, okay? So, I mean, like, it's very obvious the effect when you just can see it, but we normally don't think about it. We're just putting our shoes on and they just need to not come off. So, for this video, I'm going to be talking about the right side of the body as if you're tying your shoes toward the right side. Again, we need to be tying them. Universal human design. We need to even allow human function in its natural form to even be possible. Literally, that's it to happen. We need to be tying them evenly over toward the inside, okay? Have to. Universal human design. So, this right side of the body, in doing an incorrect toward the same direction tying, will be forced to be in a constant chronic state of external rotation, right? I talk about following the thumbs, how there's internal rotation and there's external rotation. It's just half of the body's function on half of the side of the body, right? This side of the body, my right side, has external rotation. And this side of the body, my right side, has internal rotation. But arguably, the reason I say that is because I don't actually know that as far as anatomy-wise, but I'd say there's a lot more internal rotation naturally within humans than there is external rotation. And again, within my tens of hours at this point of content, I have gone into extreme depth on what the relationship within the modern day clothing that we wear and our body, and like what that relationship is and how it's affecting us. And again, there's zero opinion. It's undisputed. It's just that we don't realize these things. And so, yes, I mean, it's life-changing, and it's that simple, and it's that obvious once you see it. So, anyway, the entire right side of your body is being forced to only have, in a case of tying your shoes incorrect toward the same direction, it's being forced to only have external rotation. Do you see this like effect on the knot? Notice how, again, when you tie it over toward the inside and you press against that knot, just because one side is on top and the other side is underneath, right? The one that's over is going toward the inside. When you press, it's just pushing into a position that will place your entire side of your body into internal rotation. Now this one, incorrect tie, will press, and again, it's just the exact opposite knot, where it's pressing you into external rotation, right? If these are my feet, this foot is going in, like my toes are pointing in, as I always show, like a martial artist kick I demonstrate. I'm not a martial artist, but I demonstrate like a kick, the foot coming in, natural, healthy, toward the center line. This side, it just is not physically allowed to do that. It's being pressed out, okay? And that's all that this is. So now you're walking kind of like this, right? In a right-handed case, this is how you'd be walking, right? Meaning tying the shoes toward the right side. And you can't have any say in it. I couldn't, and he couldn't, and she couldn't, because there's a literal rope around your ankle where it's flexing, the foundation of your entire body. So, the right side of the body is getting beaten up, constant, in this case. I'm gonna go ahead and tie this correct, just so it's correct for the rest of the video. Right over toward the inside. Tie. Again, you pull it, it goes out. You pull it, it goes out. Even, but then when you press against the knot, it's going to push your feet internal, 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 every step, okay? Natural human foot, universal human design, undisputed. So, when we are tying that right side Or if you're left-handed and you're just tying a knot going the other direction, it's the exact same thing. As far as it'll have the exact same effect, but just the exact opposite side. But I'm going to discuss it as if it's right-handed because 85% generally-ish of the population of the world are, like of the entire earth, are right-handed, right? So yeah, when we have that right side of the body just being forced to work in an unnatural way, a way that it would never work otherwise, without a literal rope pulling it, or again, kind of pushing it rather into external rotation, that does so much to the body. Inside of your legs, right? Like, you have what's called adductors, muscles that are on the outside of your legs that are pulling your legs out, right? As if you were to sit here and like push your knees outward. Those are called abductors. The muscles that pull your knees in, like if you're going to hit your knees together by just pulling them together with the muscles within the inner part of your leg, those are called adductors, right? One is a B, one is a D. Abductors and adductors. That muscle on the inside of the right leg, that adductor, the muscle that pulls, which there's multiple muscles within there, but the muscles that pull that leg inward, they will get chronically overused to an insane degree. So, and muscle mass wise, physical size, you'll be able to see it on your own body, actually. The inner part of your right leg, right, it will be larger because if this foot is being tied incorrectly and each step it's trying to just get back into normal, because I've demonstrated what a natural human walking gait cycle looks like, because again, my body works naturally, so I can be the physical visual example for things like that. Because of these things is the reason my body works naturally now. When you walk, you want to be, the body wants, universal human design by itself, it will do this, just be internal with the feet, right? Internal with the arms. I always talk about internal rotation, again, coming toward the center. We have a center line. The nose, the sternum, and the spine are the things that I usually mention with the center line of our bodies. We live on an earth that pulls us directly straight down to its center with gravity. We have to have a center line or we would fall over, forward or back, left or right. So that inner right adductor will be so overly active, trying to just pull the leg back in, fighting the knot that's pushing the leg out. And that will travel all the way, because that muscle starts down where your knee is, travels all the way up into your groin, really, where it attaches into your pelvis and really, really attaches your leg to your hip, right? So the muscle on the outside of this right calf, that will also get like abnormally used, because again, if the foot wants to be internally rotating and that knot's pushing it out, this muscle is going to then contract when it shouldn't. I mean, that muscle should be used in the way that's designed to be used by our God, but it should not be forced out. It's wanting to work like here, not out, where the knot in an incorrect tying position will place it. So that will be very overused, and the inner adductor will be very overused. And this glute medius on the right side of this outer hip, there's a smaller, when we think about the glutes, right? We think about usually the glute max, or just like the glutes being larger. On the sides of the glutes, there's a smaller little glute muscle called the glute medius, and it internally rotates the leg. It's what allows your toe to point in and your whole femur to twist inward, like this. Other muscles play into it, but that's one of the major muscles. Really, that's probably the biggest muscle. I'm not an anatomy expert. I just know a lot about the human body. I definitely have not gone to like school for anatomy or anything. I think that's kind of apparent, but I'm not trying to claim to like know all the anatomy of the human body, because I do not, but that glute medius isn't allowed to work to then stabilize the leg, because really, like, I stand on one foot all the time, very naturally and easily, as we should as human beings. And that glute medius is really what's allowing that to happen. It's allowing the hips to stay even and stable when you're on one foot. And in order for that to be working, your arch has to be working up and internal. And this knot is forcing it to collapse and go external. So, I mean, doing anything, you'll feel a lot of cramping on this outer right glute. Within your right rib cage, most people can't even breathe on the right side of their body, because again, if this whole side is being collapsed into internal rotation, because I always show that collapsed into external rotation. I always show external rotation as kind of more of a downward position. You can't lift in external rotation, but if you rotate inward, you have just so much mobility, and your scapulas can get up out of the way of your rib cage. And I've again shown this in great depth, but this side of the body, again, being in external rotation, the scapula is not allowed to internally rotate. You hear my foot? I didn't do that on purpose, but twisting the arm in will also then twist the foot in. The whole body's connected, right? If one thing's doing something, something else is also doing something. I mention that all the time when if there's anything within the body that isn't working correctly, something else and many other things are having to compensate just to try to have normal function be able to continue to happen. So, because we have, again, a center line, two sides of the body, everything is connected within the body. Anywhere your foot goes, your head goes. I mean, your body's all one. So, having this right side be forced into external rotation because of this knot on the foot, around your ankle, a literal rope. Now your scapula can't even lift to get out of the way and reach. And you'll notice this when you walk around and see people, their right scapula, again, that bone on the back, right at the upper back, there's those two bones. That's what I'm talking about, the scapula. People's right scapulas will be kind of like off to the side and like off of the back. And the left scapula will usually be in a pretty normal position. So, wait for a second. Yes, because that scapula isn't allowed to actually work correct. It can't retract, right? Internal rotation, yes, it does allow for farther reach, but really what it's doing is allowing the muscles of the rotator cuff, which control that right scapula or left scapula, but it's allowing those muscles to adhere that scapula in a healthy way to the back, to the rib cage. And so that way it's allowed to move like on the rib cage, right? So yes, it does allow you to reach when you have internal rotation, but it also allows you to retract your shoulders. And so that's not even allowed to happen on the right side of the body. So the outer right pec will just be so much like bigger. Again, hypertrophy, like muscle mass, it'll be bigger because you're in external rotation, so you're drooped on the right side. And so this length up here shortens, and then this outer pec, rather than like the upper pec also helping, and this upper trap also helping, this outer pec is just trying to like take over and do things that it's not designed to do, because the body is just trying to fight to function, being pulled with a knot in a position it's not allowed to work in, not designed to work in. So this outer pec will be very abnormally large and kind of off to the side more, and you can kind of feel on your own body. Again, this goes for man or woman, because even though men and women's bodies are different, there's still musculature that's, you know, allowing the same movements and motions to happen, even though there are differences in certain ways within men and women's bodies. Point is, women still have pec muscles, just like a man would. That's just what allows the motion that the pec does to happen, right? So this outer right pec, again, because this shoulder you'll see people like this. Because if this right foot is out in external rotation, again, it travels up the entirety of the right side of the body. And so they'll be like this, and people trying to always stretch out, and then, why can't I? Well, this side needs to internally rotate, and now you're even. Naturally, I mean, you would be. Every human, universal human design, we would be even until something alters our natural evenness. So, the right side of the back of the neck, and again, when I'm talking about all these things, you can feel it on your own body. The right side of the back of the neck has so much tension in it, and so much scar tissue. If you feel the right side of the back of your neck, like directly off of where your spine is on the back of your neck, you'll feel like excess, it might feel like gristly almost, right? And all throughout here too, right? Because the point is this trap isn't allowed to activate, because if you're going to activate your trap, you're going to get to internal rotation. But if the foot is forcing you out, you will never get your right shoulder up. Never. You or I or he or she. So much tension in the right side of this neck, the entirety of it, all the way, I mean, even up into like where the trachea meets the neck muscle, like right here. If you feel into here, you'll feel like more thickness, right, and stiffness within the right side of the neck. Again, this is universal to a degree, to the degree that it is happening within your body if you are tying your shoes this direction. It's what's happening to the human body. So that right side of the body is just trying so hard to function, and it's not being allowed to. Within here, below the scapula, right in here, if you feel the right side of your rib cage and then feel the left side of your rib cage, the right side will be like, again, more bound up, and there will be scar tissue because that scapula is constantly in a stuck position, and so it's trying to move, but really it's trying to stabilize more than anything. So there's not mobility on the right side of the body. There's not strength on the right side of the body, because I've shown so often, again, just universal truth of the human body's design, internal rotation's where the strength is. And internal rotation is what allows a posterior tuck of the pelvis to, right, because tucking the pelvis posteriorly is the only way that you can open your hips into internal rotation. But stemming at the foundation, if it's being pulled externally, then none of that can even happen. So, yes. People's faces, if you there's like a little tab within your lip, your bottom lip and your top lip, that kind of like center your lip, and those will normally be off to the right a little bit, because if you're constantly to the right, everything's just shifting. It's everything. It's within your face. When people smile, you'll see, I mean, again, I'm pretty well centered at this point in my life, just because of what I've done within the clothing, and that is the reason. But when people smile, you'll see a difference in gap from the right to the left on the side of their nose, where like this happens. You'll see up here, like these wrinkles are normally more on just the right side. This left side isn't allowed to work if this right side is in external rotation. And you'll see this in people. I mean, you will. So, I mean, there's just so much within the right side of the body. It's just not being allowed to work normal at all. Because you're walking around with the left side of your body trying to have a natural, normal, healthy arch, and the left side of your body is being forced to collapse its arch outward. So just whatever that does will travel up the entirety of your body. Because the thing is, if you don't believe this stuff, we'll try to tie your shoes the opposite direction. This would be beautiful for anyone to try. It's because this will prove it to you in your own personal case. I'm just speaking truth. I'm speaking universal truth of the effect of a knot on the universally designed human body. That's all that I'm speaking on. Zero opinion. Zero opinion. If you take your own shoes, and if you normally tie them toward the right, tie them the exact opposite, just to try. Do not do this like prolonged, but try it. tie it the exact opposite. So tie a left-handed knot if you normally tie a right-handed, and just walk 5 feet and walk back. Or don't even get out of your chair, because you won't need to, and you'll see the effect. And I'll show that here for a visual, right? If we go the way that most people tie their shoes, unevenly, right, toward the same direction, which is the right now, and I pull this, right, I'm just pulling horizontal, it's going left. This side, I pull horizontal, and it's going left. Now if I were to do what I just said to try, just so you can prove this to yourself, take it and go the opposite direction, right? Same direction, but toward the left, and pull it, and it goes right. Okay, and that's directly on where your ankle flexes, and there's no fighting that, no matter who you are, whether it's me or any other person, he or she or anybody. I mean, it's that obvious and it's that simple once you know. So, yes, the right side of the body is just getting so damaged. And what's happening is you're training that patterning. Again, all those muscles you can visually see, you can physically feel on your own body size differences left to right because of this knot. And so what you're doing is actually training those muscles to work in a position they're not supposed to, they're not designed to. And so what's good to say is when you do start tying your shoes correct, just the way that they should be tied, all humans, universal human design, then it's not going to feel right at first. It just will not, because you've had potentially decades and decades and decades of training your body to work in a position it does not work in. And so allowing it to be normal doesn't feel normal at first. You have to have an adjustment period. And I have been going through that. And let me give a little disclaimer, just some authenticity, some truth, I'm not trying to make this something that it isn't. There's a lot of pain. There is. Because again, half of your entire body has basically lost half of its function, internal rotation. And so it's not just your leg, it's not just your hip, it's not just your back, it's not just your shoulder, it's not just within your hand and your forearm, it's not just your neck, it's not just the muscles within your face, it's not just the muscles within all of between your skull and the skin, it's not just the space between your ear here, but it's all of that, plus anything that I didn't mention that is getting affected by this. So there's a lot of pain. Disclaimer, but it's worth it, because all you're doing is allowing your body to get natural again. That's it. So it's just an adjustment, and it hurts. It does. So yeah, if it doesn't feel correct, well, I know. Personal experience, I know. Again, universal human design, it won't at first, because you have to adjust to normal, which seems weird, but it's true. Again, universal truth, undisputed. This is just truth. So the point with saying that, and why I'm saying that, is if people say, hey, Evan, I watched your videos, and yes, your body functions very well now. And not only that, but I have seen since you started making your content only about 2 months ago, I have seen visually through your videos your body be transformed and changed quite a bit. I see that what you're talking about is real, but I tried to tie my shoes evenly and it doesn't feel good. Yeah, expect that. You have to go through an adjustment period. I did, and actually still am, about 1.5 years later, still going through an adjustment period. Because 24 years, I'm 25 now, 24 years, maybe not quite because I wasn't tying shoes as an infant, but 20-ish years tying shoes incorrect, the same direction, training the body to work that way as it grows. You have to adjust from that incorrect position to just a natural, normal, neutral, centered, normal position. I said normal twice, but it is. So if anybody gets a little bit hesitant or turns off of what I'm showing because, oh, I tried it, he's just making something up, it hurt, it didn't feel correct, I couldn't even walk, it felt wrong. I know that, and again, this is universal truth, regardless of if it's me or any other human showing you these things. But again, your body has just been so deeply ingrained to try to operate in a position it's not designed to, that the muscles have pulled on the tendons that are connected to the bones, right, in an unnatural position. And as you've grown, your bones have then grown in that position. I've mentioned this can cause bone spurs. This can cause all sorts of things because, again, if you're growing up from a little child, right? At one point in my life, I was about this large. Now I'm 6'2", going from this height to 6'2" tall. Having my feet being the foundation of every step, even sitting down, right? Sleeping, everything, whatever it is, having my feet be trained to work in one direction while I'm trying to operate out of a center line that the human body naturally has. There's just an adjustment that has to happen. And it will, and the body's amazing at adapting, but you have to stick with it. Because it's, like I said, it is painful. I'm not gonna sugarcoat it. It's very painful. But it's worth it. Because once your body adjusts back to its center, the rest of your entire existence on this planet as the human being that you are in this form will be out of your center line. And if you do not do this and you continue to tie them incorrect toward the same direction, the rest of your entire existence here on this planet in the human form that you are in will be imbalanced, no matter what you try to do, exercise-wise, doctor-wise, surgery-wise, anything. There's a literal rope pulling one of your feet into a position it does not work in. The body only works how it works. And I've gone over that many times, how we cannot tell our bodies what to do. I cannot tell my body what to do, he cannot tell his body what to do, and she cannot tell her body what to do. And this is a perfectly beautiful, undisputed, universal human design example of that. And it's happening in most all people, including myself, for about 24 years. So, again, there is zero opinion in this being something that is happening to humans. There is zero opinion in the effect that this is having on humans. This is not a preference lacing technique. This is the way to allow the universally designed human foot to operate. Otherwise, it will not be allowed to, and you will be getting sore. Not only that, but you are just forcing your body to go through things that it should not have to. It's not about being sore, it's about what that's actually doing to your body. You just feel it in like being sore is the avenue that your body tells you that it's being forced to do something that it's not designed to do. That's it. Okay. So, this video is very important to have for the sake of my content that I make because of what I said. People will probably be very quick to say this is uncomfortable because yes, I agree. At first it is very uncomfortable. But, again, there's zero opinion in this being correct. So, please push past that first period of discomfort that will be there. You will have to release some stuck muscles on the right side of your body, or the side, again, that is being tied into external rotation, forced to be in a chronic state of external rotation. You will have to release stuck muscles and scar tissue because it is there. Again, after years of just trying to operate in a position that it does not work in, the body will bind up out of scar tissue, adhering the muscles to the bones and the skin to the bones to try to just stabilize and try to just operate. And in those locations I said, especially on that side of the body. The other side of the body isn't as affected because, again, it's being tied in a position that's allowing its natural internal rotation, the way that the foot would naturally function. But it's not being allowed to fully do that naturally because, again, the entire body's connected, and so it's being affected much less than the side that's actually being pulled into external rotation, but there still is an effect just because the entire body has to work as a whole to do any kind of movement that it ever does. So even breathing, I've talked about that in depth many times. So anyway, please do this. Again, this is not an opinion, this is not a preference, this is universal human design. The only way to allow the foot to just be within the shoe, fitting as though a glove fits on the hand, to just allow it to operate. Okay, I do this personally within every pair of shoes that I ever own or wear. I do it in the shoes that I have on currently. And again, just if you look at the shape of a human foot, if you can go sit within an anatomy class and you can learn about anatomy and then go understand the anatomy of any human out there, again, unless they have their own actual deformity or something, then there is a universal human design. Right? This is not opinionated. This is not like I'm trying to preach something to you. This is just the truth. So when you look at the shape of a natural human foot, universal human foot, it's just shaped this way. It's shaped the way that the lacing then allows it to fit. That's all that this is. That's all it is. Okay? Same with this. This knot then does no effect to the foot. I mentioned when you put this on your foot, you will just have a neutral, relaxed, but in a good kind of way relaxed, as in just natural foot. And you just go through life with a thing of protection on your foot with just about no alteration to its operation. That's all that my lacing technique is, shoelacing and tying technique, and it's just this. It looks exactly like this. Do it to every shoe that you wear. That's not like me trying to tell you something. That's me saying, your foot does what it does, let it. Period. Done. Every human. Again, unless you really do have your own very personal situation. So, okay. Yeah. I know that it's discomforting. It feels weird. It feels incorrect to do it correct when your body has been so beat up from shoelacing. I'm almost tearing up just because I don't want people to dismiss this, and I don't want people to, yeah, because it's not something to believe. There's no belief in this. I know that it might seem weird because it doesn't get talked about often, but this is just, it's just truth, universal. So, anyway, as I stated, my name is Evan Strong. I will be designing clothing because, as well as these shoes and the effect that the laces has on the way that the shoe fits on the foot and how that affects the entire body, again, what I've mentioned in this video, there's also things within other items of clothing that we wear in 2024, especially the designs from 2024 and the modern man-made materials that are really affecting our bodies. Not quite in the same way as a knot from a rope, but imbalances and many things within clothing, and I go into very great depth again in my, at this point, tens of hours of content of me just speaking dialogue like this universal truth of the human body and what the clothing is doing to it. So I will be designing clothing, minimal clothing made out of 100% natural materials, as it should be and as it almost always was up until just a few decades ago, until all these newer materials have been invented and made chemically, man-made materials that shouldn't be on the body anyway. My designs will just allow, through all the knowledge and understanding that I have between the correlation of the clothing that we wear and the human body, I will do the best that I can. I've never designed clothing, so bear with me on that, but with the best that I can, with my understanding, which is immense, on the relationship between clothing and the human body and its natural function, I will incorporate within my designs seams that just sit where the body needs them to, shoulder seams at the shoulders, top seams of the shoulders behind them to just allow movement and internal rotation. And so then your shoulders will kind of almost follow that seam and just allow internal rotation to happen. Pants up above the hips, front of the waistband of the pants slightly higher than the rear to reinforce that tuck of the pelvis, the things that I already have shown within my content, how to do freely within the clothing you already own with nothing but a pair of scissors, and the things that I do personally within the clothing that I wear. I will incorporate those type of things into my designs, again, to the best of my ability. I have never designed clothing, but I have a lot of understanding of this stuff, like very, 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 very immensely deep. And again, proof of that is within the content that I've already freely posted and placed where this is placed. So if you'd like to purchase my clothing when it comes time for it to be available, please only purchase it if you purchase it in a size that actually fits you, because that is the whole intent, again, to allow it to sit at the hinge points and the pivot points of the universally designed in the image of our God, who is Jesus Christ, human body. So again, thank you. We do have a natural center line. This is a must. It is zero opinion. This is universal human design. Has to be done to allow the body to operate normal. Otherwise, you will just be forcing it to do something it is not designed to do, which nobody can do, not I nor any other human. Okay, so thank you. Today is the 14th of September, 2024. Yes, if you'd like to purchase my clothing, again, stick around. I have many videos already also, not only on clothing, but the natural functionality of the human body, and I go into depth of what modern 2024 is doing to the human body and just the way that the human body does work before it gets altered by whatever it may be. So again, my name is Evan Strong. Thank you for watching this. I'm glad that I'm able to be the vessel to shine light on truth. So thank you.